Good evening, you're watching Sightline. Today in our studio, United Nations Development Program Resident Representative for Mongolia, Ms. Elaine Conkievich has arrived to talk with us. So, how are you today, Ms. Elaine Conkievich?
Fine, thank you very much for having me.
So it's great to have you here for the second time in our studio.
Thank you, it's a pleasure.
Yeah, so I'd like to say congratulations on the recent launch of the COVID-19 Impact on Women and Girls in Mongolia study. So last October, when you were here the first time on our Sightline, you defined the women and girls as the most vulnerable groups to the COVID-19 impacts. So in what ways do your recent findings of the study prove your statement?
Thank you very much for the question, and indeed it's a pleasure to be here. We already started last spring, UNDP, to do a rapid social economic impact assessment on vulnerable groups overall. And through that initial study, we already saw that women and girls were particularly vulnerable to the effects of the prevention measures in Mongolia. So in follow-up to that, we decided to do a very specific study focusing only on women and girls. And so this is the study that you've just mentioned that we launched a few days ago in connection with also International Women's Day, because as you're aware, International Women's Day focus is on women in COVID and leadership in COVID. So the study was based on numerous studies done by other organizations as well as some qualitative surveys, questions on women and girls throughout the country in Mongolia. And clearly it shows that the impact on women and girls, whether we talk about access to healthcare, education, increase in domestic violence, increased unemployment, increased unpaid care work, is all having a disproportionate burden on women and girls.
Mm-hmm. So can you tell us the reason why there are more burden on women that's caused by COVID-19?
Sure. If we look at the health sector to start with, 81.9% of healthcare workers in Mongolia are women. Mm-hmm. That's way above the global average, which is 70%. Yeah. So you already have many women working very hard, tirelessly mm-hmm. in the healthcare sector.
And they're putting themselves at risk.
They're also putting themselves at risk, of course, exposure. And there's been a number of healthcare workers who have been infected with COVID. In addition, women, take care of their families, mm-hmm. traditional values in Mongolia. So not only are they having to work long hours, hard hours, but many have obviously children, and they have to be concerned about who's taking care of the children while they're at work.
Because the schools and kindergartens are not working.
Yes, and so also looking after the educational burden of the children, not just looking after their safety and well-being, but also that they're able to have their lessons online to learn effectively, and all of this is a very cumulative burden for women in the healthcare sector. Beyond that, if we look at the economic sector, women are generally employed in the services sectors and mm-hmm. the trade sectors. Yeah. Those are sectors that were dramatically impacted by the restriction measures in Mongolia. Mm-hmm. Also, women are largely engaged in micro and small and medium enterprises, which had great difficulty and have great difficulty to keep afloat, to keep running, to pay the rent, to pay... Yeah. For their loan repayments, for example. And so many of them had to either shut down or severely cut back, which of course reduced the income to women and their families. Mm-hmm. Women are also largely employed in the informal sector, where they don't benefit from the state social protection measures because they're not officially registered as being formally employed. And so that's another way that women have been particularly impacted. Mm-hmm. If we speak also about domestic violence, for example, there have been increase in domestic violence over the last year, if mm-hmm. you compare with previous periods. And there's also interesting differentiation between when the restriction measures were in place and when the lockdown was in mm-hmm. place. And during the lockdown, you saw a decrease in the numbers of calls to the helpline, probably because when you're at home close around an abuser, it makes it very difficult to reach out and get help. But you also saw a dramatic increase in the more severity of the domestic violence situation, in the crimes over the offenses. While there was a slight increase in the number of offenses, there was a very dramatic increase in the number of domestic violence crimes measured during the lockdown period last fall.
Mm-hmm. Okay, so how long did you work on your study?
As mentioned, we started in March when we had the social economic impact assessment, and then we also contributed heavily to an assessment done for the whole UN, which was part of the UN's social economic response plan. And then this was followed up, as I mentioned, with a very targeted study on women and girls, which was done through December. So basically from March to December last year was the period for which we examined the data, looked at the impacts, spoke to people that fed into the study that was just released. And this study was done together with the Asian Development Bank and the National Commission on Gender Equality. And so we're very pleased to have been able to work with them jointly and be supported. And this also brought about additional data and information that could be put into the report.
Okay, so if we imagine very positively, and let's say that the COVID-19 pandemic will end in a year or two, so then how chronic are the impact of the situation, the post-pandemic?
Yeah. That's a very difficult question to answer because I would say that we don't really know yet because we're still in the phase of the restriction measures, I mean, most recently lockdown, and so the full impact is not yet known, I would say. But I would say that the impact, I think, is severe enough that it will take time, meaning a couple of years, hopefully not longer, but to overcome the situation.
And to get things back to normal.
Yeah, we hope so. I mean, now the vaccines has started. That's a very good, positive step. It will take several months, of course, to have the population of Mongolia vaccinated. But the signs of opening of the borders in a couple months, will help with the trade and the economy. Some stimulus measures are still continued by the government. So all of these actions will, of course, contribute to improving the situation, but there's still a long way to go. And things such as domestic violence, I mean, they existed before the pandemic. They only got worse. They were exacerbated. So it just shows that even more efforts are needed to prevent domestic violence and violence against women and girls.
So apart from the vaccination and the opening of the borders, what particular ways are there that are needed to help solve this impacts and issues that are concerning the women and girls?
Yeah. Well, one way definitely that needs attention is more women in decision making. Mongolia is underrepresented. There's only 17% of women in the parliament.
Global average.
Which is below the global average. At the local rural level, only 1/4 of the members are women. And in the State Emergency Commission, which is a very important body now, which is dealing with the entire COVID response, there's only 3 women out of 26, which is just over, it's 11.5%, I think. And that's even below the government-regulated percentage of women that should be in that body. So in order to have a really effective gender-sensitized response to COVID-19, you need to have women in these bodies that are looking at the measures from a woman's angle. Yeah, how do the restrictions impact on women's access to health care, women's burden on the teachers, who are vast majority are women as well. So more women in decision-making and in the active bodies and agencies that are dealing with resolving and responding to the crisis are definitely needed. Moving women out of the informal sector into the formal employment sector is a very important step. More efforts need to be done in that so that women are covered by the social protection system formally. Some more innovative things and forward thinking, such as looking at unpaid care work, working to redistribute and rebalance and reduce the unpaid care work of women. But beyond that, the unpaid care work ideally should be quantified in monetary terms and hopefully in some way either compensated or, for example, some countries would look at paying pension towards unpaid care work so that the state recognizes that although women are not paid for taking care of children at home or doing the household, that is work. Yeah, that's very important work which upholds society. And so this has to somehow be quantified and given a monetary value, and then ideally in some way compensated.
So we need more women in the decision-making process, and also the unpaid care work needs to compensated by maybe pension, or in China they say that if a married couple, if they split, the women will get the
compensation for the care work that she did. I mean, the level's still way too low, but at least it's a first good step in the right direction to recognize that this care work has a value and should be compensated.
On your several months of survey on the women and girls, how many women and girls did you meet or did you survey?
The survey that we did in the spring, there were several hundred women that were spoken to as part of the survey. For the latter part that was done in November, December, it was with 100 people, which partially were men. There's about 2/3 women, 1/3 men, because also asking the impact, on men's lives in connection with the impact on women. So, but beyond that, I mean, a large amount of statistical data was used, some of which is sex disaggregated, I mean, from the National Statistics Office and from different ministries, from the National Commission. So all of this factored into the results of the study.
Okay. So another recent notable event by UNDP is that we joined the Accelerator Labs.
Yeah.
So it's the fastest networking group.
Yeah.
And did the Accelerator Lab in Mongolia work with your study on women and girls?
The Accelerator Lab was launched also just recently, and we brought on board 3 new colleagues, 2 of who were women as well. So they weren't so involved in the study because they were just started
launched
working
recently.
Yeah, were hired at the end of December and early January. But indeed, the Accelerator Lab, I mean, the mission of the Accelerator Lab, if I can call it that, is to really support and think about development differently. Not only in applying innovation, new technology, but really to look at problems in a different way and to try to really probe and experiment. And so through the sense-making that UNDP office did last year, which is a kind of a systems thinking approach, which is something very new in Mongolia, we identified that there's 2 overarching themes that really should be in focus when we talk about doing development differently and doing development for a post-COVID world in Mongolia. So through this, the 2 overarching themes are dignified lives and rebalanced economy. We feel that these 2 things are very important for the focus. But linking those 2 things together as a common thread is the digital transformation, because moving forward, and we've seen now because of all the lockdowns and the restrictions, so many services and actions needed to move online, from education, even remote healthcare, banking, business operations, basically everything. And so the Accelerator Lab is really very much focused on improving digitalization, particularly in public service delivery, which can be healthcare, it can be education, and social services. So that's the main focus that they're working on right now. And this is very much in line with the priority of the government of Mongolia to work on the digitalization. So we really want to also use those digital tools that may come to also benefit the lives of women and girls and help to recover from the impact of COVID-19.
So in order to improve the digitalization process of Mongolian state works, will the Accelerator Lab in Mongolia work with the government of Mongolia?
Most definitely. When we launched the Accelerator Lab, we did this together with CITA. We're also in contact with the Cabinet Secretariat, with the National Development Agency, with ministries. So most definitely we'll work with the government. But also we would like to engage and work with the private sector, because very much the engagement of the private sector in the Sustainable Development Goals and achieving the long-term development plans of Mongolia, Vision 2050, etc., needs to be increased and needs to be improved. So we want to also make this linkage between the government priorities and bringing in the private sector, because that's very important for the financing of the Sustainable Development Goals.
So I'd like to go back to the talk about the women and COVID-19 impact on women and girls in Mongolia study. So you have done your study, but following up, what are you going to do?
Sure, thank you. Yeah, it's very important because the study was done to gather the information to raise awareness, and so that's also to have a baseline and to know really what the issues are. But it's not enough just to do the study and put it on the shelf, right? So we want to work even more closely with the government of Mongolia so that the different ministries, the State Emergency Committee, the other bodies that are dealing with the COVID-19 response have a gender perspective when they're looking at it. So it's very important to have consider when actions or measures are taken the differentiated impact that would be on men and women, for example. But that's on response. What we really also need to be looking at is the longer term recovery, from COVID, which means over the next 2, 3, or in worst case 5 years, the longer term. And here again, we want to work with the government of Mongolia to have a gender sensitized recovery. And ideally, it would be good to have even a gender strategy for COVID-19 recovery. But barring that, not having that, certainly in the different sectors, health, education, social protection, employment, labor, the recovery actions need to be looked at through that gender lens. I think also raising the awareness on, for example, very dramatic situations around domestic violence would hopefully also spark more action towards not only helping survivors of domestic violence by providing essential services, ensuring that the shelters are open, that people can reach out and get help, but ultimately what needs to be done is preventing the domestic violence in the first place. So a lot of work needs to be done in that area. And so we hope this study will also spark work not only with women, but work with men, actually, because there needs to be a lot of work done to change stereotypes, to work with perpetrators of violence, for example, to improve the conditions overall. And also this rebalancing, for example, of the unpaid care work, to get more men involved in the daily lives of the families and the household will improve the situation overall.
So, okay, thank you very much. So our time is coming to an end. And what final message do you have for our audience?
Well, first, I would congratulate all women on International Women's Day, which of course has just passed, but still, I think it's very important that the focus of this study and the focus on improving the lives and empowering women should not be just in connection with one day a year on International Women's Day, but we really need to have it in a constant focus, always looking and striving towards achieving that gender equality, improving the lives of women and girls, because when that's done, that benefits the whole of society, all families, all communities, and we need to look at it from that approach.
Okay, thank you. And there's a Mongolian proverb that means that if you educate a man, then it will just that man's life. But if you are educating women, then it means that you are educating like lots of generations that down the women.
Yeah, this is very true, and therefore that's another reason to particularly focus not only on educating girls, which are very educated actually. There's a very high percentage, as we know, of women and girls in the tertiary, even more than men. So we need
like 2.1 times.
Yeah, we need to utilize their resources and their knowledge and their skills and their benefit for all of society, and not just thinking that their main function is in the household to take care of the family and the children.
Yeah, definitely. So, Ms. Elaine Conkievich, thank you for coming, and I wish lots of luck for your future endeavors.
Thank you very much.
You've watched Sightline. Today we talked to Ms. Elaine Conkievich, UNDP Resident Representative in Mongolia, about the recent launch of the COVID-19 impact on women and girls in Mongolia, and also the other recent projects by UNDP in Mongolia. Thank you for watching. Goodbye.